So we're looking at preconception care, okay, but we're looking at this preconception care as a continuum of care. That's like, it's something that should actually continue. All right, so I'm trying to give reasons why preconception care shouldn't be a one-time thing, or a two-time thing, or a three-time thing, but should be something that is continued throughout pregnancy. So for preconception care, we said that as a continuum of care, it recognizes that the mother and the child health doesn't begin at pregnancy. So it starts before the mother even gave birth to the child. I don't know if you understand. So it continues throughout pregnancy, throughout childbirth, and also beyond, till we can say that the baby is, into teenage. Yeah, you can actually say something like that. So this life course approach ensures that health interventions are timely, okay, they are well checked along the time of growth and integrated, and they are also kept up with, okay, so that the mother and the child, their outcomes are positive. So what is continuum of care? Continuum of care in reproductive health refers to time dimension. So the person should be cared for across all the stages, okay? Preconception, when they're pregnant to the person, childbirth, after delivery, during childhood. So place dimension, so the care should cut across all the places that are the possible places, at home, community, hospital, So preconception care is the first link in this chain, laying the foundation for a healthy pregnancy and reducing the risks of complications. Okay, so preconception is like the starting of the care you are supposed to give this person, not the beginning and end. Do you understand? So that's why they actually say it's a continuum of care. Okay, so if you care for the person when the person has not actually come out to this world, the person is still in the uterus, it will prevent unintended pregnancies. So it also has to do with this. So sometimes you don't really want, you don't want somebody to give birth to a child that they can't really take care of, right? That area there is complex, right? Different people have different approaches to it. Okay, for me, I'll ask the person that if I'm able to sponsor the child, sure, right? It depends, right? It depends on the circumstances that actually brought the pregnancy. That's why I said it's a complex area. So you want to also reduce the rate at which the mother and the child is dying. Okay, you want to improve management of chronic conditions like diabetes, hypertension. You want to promote healthy behaviors, support genetic counseling and risk assessment. So components of preconception care, that's things that you should look out for. Okay, so you could see that for the various interventions, I'll just be listing them, where you can pause to look at the various interventions that could be done. So biomedical approach, down here looking for any disease condition. Behavioral, okay, you're actually looking at substance abuse, hard drugs and all of that. Nutritional approach, you're looking at what they are eating. Psychosocial, you are trying to look at depression, anxiety. Are they being abused? Do they have the right support that they need? Then environmental approach, you are looking at the environment they are staying. Is it clean, okay, or is it polluted? Then reproductive planning, okay, so you want to ensure birth spacing. Okay, so you don't want the woman giving birth back to back to back. Okay, back to back to back. So implementation in Nigeria and Africa, just when you say Nigeria, of course that's like Africa. Community health workers are the ones that usually deliver education to these women in the rural areas. So traditional rulers, churches, mosques and all of that, they usually help to promote early care seeking. Then schools-based programs can reach adolescents before reproductive age. Okay. Integration with the existing services like immunization, HIV clinics, family planning centers, right? So all these facilities all actually come around to educate people on this aspect of care.